Greetings from Indiana University of Pennsylvania in Indiana County, Pennsylvania in the US of A. We'd like to present a white paper that we submitted for Singapore for the World Nursing Conference on effectiveness of ReadyPA emergency preparedness programs in rural western Pennsylvania in the event of a prolonged power outage. I'd like to introduce my colleagues who will also be speaking. My colleague to my right here is Dr. Cindy Zidek. And next to her is Dr. Michelle Kreitzer. We are all community health nursing faculty at Indiana University. And the project that we have done, we did with our, we included our nursing students, senior level nursing students. Electronic medical equipment, once available only in hospitals, is increasingly being provided at home, in the home setting. Electronic medical equipment, which for purposes of this paper is going to include nebulizers, treatments, hoists, mechanical equipment, beds, pressure relieving mattresses, stair lifts, IV pumps, and things like that. Feeding pumps, oxygen, blood glucose meters, and others. Electricity is needed for all of the support this equipment for use in the home. This article, and well, actually this presentation that we're presenting is on, consists of a joint student and nurse faculty community health research project regarding the effectiveness of a program that already exists called ReadyPA, which my colleague will talk a little more about in the background section.
When we took a look at emergency preparedness in our state, what you first need to understand about the United States is we have the Federal Emergency Management Association, which is run by our government, a federal program, and each state has developed its own offshoot from that. And we have in Pennsylvania Emergency Management Association. So when we looked at this, we looked at our program in our state, and are the residents in our state prepared in the event of an emergency. And the background behind this, right now in the U.S., we are in the weather season, the severe weather season. We have this every year. We tend to have in rural Pennsylvania a lot of power outages, either related to summer storms, flooding, or in the wintertime, a lot of snow and a lot of ice. So when we were looking at our nursing students and our clients, we were trying to figure out, are the residents in our state prepared in the event of a prolonged power failure lasting more than 24 hours? So here we are, we're looking at from the government, are you prepared? Is there a plan? Our government has programs in place to mitigate the seriousness of events, but do we have that? Does it trickle down to our own county in western Pennsylvania? And just a little side effect, just a historical note, so that you understand where we're coming from. We did have Hurricane Sandy last year, and we had over 3 million people along the East Coast up through the state of New York without power, sustained power failure for more than 24 hours. So we're looking at in Pennsylvania, are they ready? Are they, do they have a plan in place? And is there a way to help others? What concerned our students and ourselves as community health nurses was the number of people we saw in their homes with using electronic medical equipment. And what we noticed from the discharge instructions, most of these people had no plan in case of a power failure. Our rural area in Pennsylvania is more vulnerable just because it's rural. But when things happen in our area, they are more prolonged, and the residents in our area are more vulnerable to losing power. 1/4 of the people in the United States do live in rural areas in this country, so it is a big problem in our country.
Okay, as Dr. Zidek had touched on, we do have many natural disasters as well as some man-made disasters that occur across the United States and in the world in general. In the United States, we do have several entities that assist us in responding to disasters when they occur. Department of Energy in 2011 published a report that identified what they would do in response to a prolonged power failure. However, that report did not address the need for community preparedness in the event of a prolonged power failure. The Department of Homeland Security is our major entity, was formed to protect the nation from the many threats that we face, which include man-made disasters such as terrorist attacks, such as 9/11, which happened here in the United States, and the London bombings in 2005, which both resulted in prolonged power failures. It affected the infrastructure of our nations. And then we have the natural disasters. Dr. Zidek had mentioned Hurricane Sandy. We had Hurricane Katrina. We've had numerous earthquakes throughout the world, tsunamis, things like that that will impact us. In 2012, the Department of Homeland Security did, in the United States, disperse some information regarding a fast-moving band of thunderstorms that was moving through the Washington, D.C. area, and that information was missed somehow by our power companies, and as a result, over 1 million people had a loss of power for a prolonged period of time. So that could have been avoided had communication been a little better there. Federal Emergency Management Agency, or FEMA as it's known in the United States, works under the Department of Homeland Security in order to improve response time in the event of an emergency or a disaster. And during Hurricane Katrina, there were many mistakes made, and FEMA has learned from that and has improved its response time in response to a disaster, but still needs to improve on educating the community about preparedness and preparing communities and populations. Internationally, professional nursing organizations could be key in sharing information with each other on how to prepare and respond to disasters. The International Council of Nurses states that nurses in every nation should be equipped to assume a leadership role in an effort to prepare their countries to respond to a disaster. You could look to your national nurses associations for advice on how to form such coalitions, or even the World Health Organization would be a good place to look. And community health nurses are in a prime position to take the lead on this, because who better knows the needs of the community other than the nurses who are working in the community. Here in Pennsylvania, we have the Pennsylvania Emergency Management Agency, or PEMA, and PEMA developed a ReadyPA campaign, which we had discussed prior. And this campaign has 3 steps to it. We say to be informed, be prepared, and be involved in case of an emergency. And it's located on the internet, so people have access to it. They know where to find it. It has information for the general public with identifying special populations such as the elderly or the disabled. When we were looking at as we were teaching our community health courses, we thought, what better way to prepare nurses to respond in the event of an emergency or a disaster than to start with our students, who are the future of nursing. So that's what led us into this study. When we involved our students in the study, we wanted to ask 2 questions, and they are: how effective the state's campaign, ReadyPA, has been in informing rural residents reliant on electronic medical equipment about the campaign, and how effective has the state's campaign been in informing medical suppliers about the program and the need for social support networks for residents reliant on electronic medical equipment.
So we have 2 good research questions, and then we proceeded with IRB approval from our own Indiana University, and on the next PowerPoint slide you'll see the IRB log number. I think that's pretty standard throughout the globe. And our study was quantitative, cross-sectional, descriptive design. It wasn't a true experiment, it was quasi-experimental. We had to use a sample of convenience. Our sample was a stratified sample of the population of Indiana County in Pennsylvania. We are considered a rural county, and the way we did this with the stratified sample, which does really work well, by the way, for if you have a class of nursing students who want to try this, we divided our telephone numbers, A through Z, the letters of the alphabet, and then each group of students, there were 2 or 3 assigned to each letter, made phone calls from that section of the phone book. And we randomly picked a number like 7, and you called every 7th person that ended with the letter M. That's how we got our stratified sample. The limitation to that is it has to be residents in Indiana County. We wouldn't call anyone that didn't have a telephone. The other limitation in this day and age is the fact that if you just use a cell phone, you're not in our phone books in this country. So those are 2 limitations. We weren't as worried about the use of cell phones because we don't tend to see a lot of younger people in need of electronic medical equipment in their home. There are some, I'm sure, but for purposes of this study, we just had to eliminate that group. So that's our sample. Then we did develop a telephone survey. We did train the students so that everybody answered questions the same way. The survey itself had to go through IRB approval. We had to make sure that if there was something serious that a patient or a resident would have said, that students knew how to answer that, and then referrals were made back to us at the university if they needed to talk to someone further. An example would be, we did have a gentleman, one of the students called, and he was truly bedridden, no way to get out of the home, no way to call for help, and said he would just lay in his bed if in the event of a power failure lasting more than 24 hours. There was nothing he could do. So that's a serious situation. When things like that come up, you don't want the students to handle it. So we did have protocols in place in our survey. We do have another survey that we did for the medical supply companies in our area. This was a sample of convenience. We just looked at the white pages, whitepages.com, and we found all of the suppliers in our area and found that. We found 14 companies. We called them and asked them if they were aware of the ReadyPA program and if they had a plan in place in the event of a sustained power failure, and would they be able to provide support services for clients in need. So there was 14, and it was a sample of convenience. The other thing that I mentioned was in our design, it's considered a rural, vulnerable population. We have a U.S. Census Bureau in our country, and every 10 years we do a census of the population. And if the population is less than 284 residents in a square mile, it's considered rural. And that's where 1/4 of our country is rural and where we live is rural.
An expert panel of nurse educators at one university validated the content of the survey before we gave it to the students to distribute. The script of the telephone survey included requesting residents' consent for the interview and a statement regarding approval by our research department, the IRB. 30 senior community health nursing students assisted with both the data collection, the phoning, as well as the analysis of the data. And the information was reported that they reported on were effectiveness of the ReadyPA emergency preparedness in rural communities resident checklist and the medical supply checklist that was explained by my colleague, Dr. Zig.
For our results, we had 128 respondents. Remember, it was a stratified sample of our population in Indiana County. 128 residents do use electronic medical equipment, which was 13% of the phone interviews that we did. Of those, do you have a plan in place? Most of them did. 24% did not. 76% did. This was their plan. If you look at this slide, the graphics, it shows that most of the residents in this area use gas-powered generators. The next thing choice was batteries. One thing that we did notice from this, approximately 25% of those who use electronic medical equipment would require assistance from hospitals or urgent care centers or supply companies because they don't have a plan in place. And if you think an extra 25% are going to show up at your ER because they don't have any way to use their electronic equipment during a natural disaster, that's a big demand, extra demand on the ER for nurses and for other personnel. The next question we looked at was our ReadyPA plan, and are people in our state, in our county, aware of this plan? What we found, surprisingly, was most residents are unaware that there's a state plan in place for readiness, for preparedness, the ReadyPA plan. What we think is going on is most of the people we surveyed were older residents. This is the population group that tends not to use the internet as much as the younger population. Most of the healthcare information that's distributed now throughout our country and in our state, the primary means of communication is the internet. So we think the internet itself, just the fact that it's distributed that way, is not reaching the population that it needs to reach. That's another potential research project for any of you. But our population, we had 76% unaware of our ReadyPA program. The next part of our survey, question 3, we looked at medical equipment suppliers and would they be able to supply alternative equipment in the event of a sustained power failure. And yes, we did have 5 of the companies that said they would, and 2 of the companies said they would not, which is significant. 62% of our suppliers are able to offer alternatives. This is the important question that we ask them. Do you keep a paper list of your most vulnerable clients? Half of the companies do, half of the companies do not. It's important, we think, to be able to reach clients in need of services in the event of a sustained power failure. And most of the healthcare personnel would not have access to the list, like what people use in their homes, because not everybody is seen in an ER or a hospital or urgent care center or home health even. So half and half. Half have the list, half do not.
Limitations of the study were that it was a relatively small sample size. We did have 128 participants, but that's fairly small. And it was in a localized geographic area, and both of these limit the generalizability of the study. Just to give you an idea where Indiana is, it is east of Pittsburgh, west of Altoona, and north of Johnstown. So we're about right around in here. That's where we are located, Indiana, Pennsylvania. And as Dr. Zidek had said previously, 1/4 of the U.S. population lives in rural areas. Indiana County is definitely a rural area, and this picture here is typical of what the roads look like in the wintertime. This actually looks pretty good. Our national agenda within the Department of Homeland Security and FEMA includes using communication to improve health outcomes for our residents. And in Pennsylvania, it is our community preparedness campaign, ReadyPA, is what we use. It's an excellent plan, has excellent information on the website, but again, it has limited public awareness. As we had said previously, 74% of study participants were unaware of the campaign. 24% had no plan for emergency. 9% would phone for community support. It wasn't specified who they would phone. Are they phoning family members? Are they phoning 911, the emergency response system? Who were they calling? 7% would leave the home if their power was absent for greater than 24 hours. And as Dr. Zidek had stated, anyone who had a plan in place said they used gas-powered generators and batteries to support their medical equipment in the home.
Implications of the study that was done in this one rural county may provide an indication of how much of a problem emergency preparedness is in the event of a disaster for other rural areas. The internet seems to be a predominant choice for disseminating community information on preparedness, and yet rural places, that's not something that maybe they would be able to access. There also seems to be a gap in the emergency preparedness for medical equipment suppliers for vulnerable patients, and dependent on those that are dependent on this equipment in a rural area. For instance, 1/3 of the residents surveyed reported that they would request community-based assistance during a prolonged electrical power failure. They would request this help from hospitals, nurses, emergency services, and medical suppliers. So there seems to be a gap in what's available and what rural folks are maybe best able to access. Community health nursing students, kind of going back to the fact that we wanted to indoctrinate our students into the community and how their function would be as community health nurses. They were able to take on a more of a professional role in actually doing a lot of the data collection as well as the analysis with Dr. Zay. And also implications for the study. We can develop further strategies to develop strategies for potential disasters, not only in just Indiana County rural area, but maybe thinking wider outside of Indiana County and other rural areas that can be very similar across the U.S.
In conclusion, our study identified that there's a prolonged power outage does pose a health risk to populations reliant on electronic medical devices, and especially those in rural populations. And awareness is key. With the 74% not being aware of the ReadyPA program, we need to really look at our sources for disseminating information. ReadyPA has the website, it's out there, it's easily accessible, but what we don't think about is sometimes people in rural populations they have very limited internet access. The service isn't there, they can't always get online to check these things out. And maybe it wouldn't occur to them to look for something like this. Some people might say, how about Facebook, how about Twitter? Well, same thing, you might not have the service in the rural areas. So we need to look at some other technologies, maybe a television ad campaign that identifies ReadyPA, or something on the radio. Because with these rural, people live in rural settings, they do, even if the power goes out, some do have batteries, they can still listen to the radio, whatever. But another way we could do this is just go to the old standby paper flyers that you can just dispense and put in someone's mailbox, that everybody would get this thing. Just a little brochure that tells about the ReadyPA program. That might be the best way to disseminate this information about the program. And what can we do with this information in the future? We really need to identify best practices for emergency preparedness in the rural areas. And as I stated previously, community health nurses are in a prime spot to do this. So they can look to the International Council of Nurses, your national nursing organizations, and the World Health Organization has a wealth of information that we can use in order to develop these best practices. And we also need to conduct some research that explores the needs of nurses who are out there caring for these people who are vulnerable and live in rural populations, in order to prepare the nurses to do their best in caring for these